Hello everyone, welcome to M3 Academy. M3 Academy के सुपर 100 टॉपिक्स फॉर नीट पीजी विच हैव 100% predictability. इसमें अपन आज लेके आए हैं इन्फेक्टिव एंडोकार्डाइटिस. So most common organism causing infective endocarditis. So first of all, most common organism is Staphylococcus aureus. As we know, the most common agent in the hospital are hospital staff. So most common organism is a Staphylococcus aureus, or you can remember like this. SA means सबसे अधिक means most common organism is a Staphylococcus aureus. Now next, community acquired native ball endocarditis. For it, lives in a street in a street, so streptococci. Now healthcare associated native wall endocarditis. As we know, healthcare associated, so healthcare means staff or hospital staff. So again, Staphylococcus aureus. Endocarditis in the injection drug abuser in right side. Right side contain R, so Staphylococcus aureus has R, and in the left side as we write left E, so E for enterococci. Now Staphylococcus has L and R, so it is associated for the both side, left and the right side. Next is the single most organism causing prosthetic wall endocarditis. Prosthetic wall endocarditis is a Staphylococcus aureus. As we know, prosthetic wall transplant done by the staff. So staff means Staphylococcus aureus. Most common group of the organism causing early prosthetic wall endocarditis. Early means less than 12 months of the age. So early, E for epidermatitis. So Staphylococcus epidermatitis. We can read like SE सबसे early, E for early. Now, late prostatic endocarditis, late means delay. So, Streptococcus viridans, very delay. Very delay means late. Now, acute infective endocarditis, acute staff. So, again, Staphylococcus aureus. Subacute infective endocarditis has Streptococcus viridans, enterococci, and cones and Haeckel group of the organism. Now, cardiovascular implantable electronic device associated endocarditis. As we know, hospital staff is associated in the implantation of the electronic devices. So again, Staphylococcus aureus and the cones. As we know, the implantable devices are the conical shape. Conical shape. So cones means cones. Coagulase negative Staphylococcus aureus. Now, when the culture is negative when you using antibiotics, so organism are killed. Now, nutritionally variant Staphylococci, if there is no nutrition, no culture media, so culture is the negative. Now, Haeckel organism, you can remember like endocarditis got hacked means culture negative. Coxella burnetii, all bacteria are burn out, are burn, so are destroyed in burning, so culture negative. And Bartonella again you can remember like bird, so culture negative. Now in the Pseudomonas P for parental IV drug abuser. In the central venous catheter, C for the cones organism are responsible for this. After lower bowel genitourinary manipulation, En means enterococci, group T enterococci. So in this way we are learn about the most common organism causing endocarditis. Now the second slide focused on the source of organism causing infective endocarditis. So in oral cavity, as we know, oral cavity has a teeth, and another word for teeth is a dant. So viridans, Streptococcus viridans, because dense means dant means oral cavity. So Streptococcus viridans is a source of endocarditis in the oral cavity. Now next is Staphylococcus aureus in the skin, just means the S for S. Haeckel organism in upper respiratory tract infection. As in upper respiratory tract infection, we got cough and cough got sound like Haeckel. Now Streptococcus galolyticus, G for GIT means colon. And enterococci, as we know, genitourinary contain EN, so EN for enterococci. Now next, modified Duke's criteria for the infective endocarditis. How we remember this criteria? Just remember this sentence B5 PM. B5 PM, what is the meaning of B5 PM? B for blood culture, E for endocardial involvement, fever, immunological phenomena, vascular phenomena, echocardiography, minor criteria, predisposition, and microbiological evidence. How we give definitive diagnosis if either two major criteria or just reduce by one and increase the minor in the odd number. So two major and zero minor. One major in odd number means three minor. Zero major means odd number. Five minor. So 3 and 5 are the minor criteria and it is in odd number. Now next thing is blood culture positive. So single blood culture positive for Coxiella burnetii uh, or the phase IgG more than 1 is to 800 titer. So this is a previous year asked question of the NEET PG. Coxiella burnetii only single blood culture positive can be considered as a blood culture positive. Now next thing is definitive criteria we have seen. Now the possible diagnosis. When we say possible diagnosis, when there is a three minor criteria or one major and the one minor criteria. If one equal, so there may be possibility of the endocarditis. And when the diagnosis of endocarditis is rejected, so if any alternative diagnosis explaining the condition, then obviously infective endocarditis is rejected. And if you are taking antibiotic therapy less than 4 days, then also uh, uh, 4 days, and it leads to resolution, then also you can exclude the infective endocarditis. And there is no evidence of infective endocarditis on the antibiotic for less than 4 days. So in this way, we can remember like the Duke's criteria. Just remember B5 PM. Now next thing is the classical skin condition. So just remember like Joshili skin. What is the meaning of Joshili? Jo means Janeway lesion. O means Osler. SH means splinter hemorrhage. So Janeway lesion. Janeway contain way means it is a vascular lesion, vascular phenomenon. Janeway N means not painful, or obviously it is your Jan, so it not give your pain. And you can see general lesion in this diagram. So it is a small edematous and hemorrhagic lesion on the palm and the sole. Now other is the Osler node. Osler contain O for ouch ouch. So patient doing ouch ouch means pain. So it is a painful, and there are so many P in there as we say it is a painful. It is a P size and in the finger pads. Now you can remember like Osler, Tendler, and Fingler. Osler, Tendler, and Fingler. So Osler is Tendler means tender and or in the fingers. Now next thing is the immunological phenomena in the infective endocarditis. Just remember this word orgasm. What the meaning of orgasm? O for Osler, R for Roth, or G for glomerulonephritis, and R means rheumatoid factor. Or you can remember like everything has the O and O because immunological has the O. Now in the diagram, you can see the Roth spot. How we remember Roth spot? R for retinal, H for hemorrhage. So Roth spot indicate retinal hemorrhage in the infective endocarditis. Now, next thing is the valvular vegetation in rheumatoid heart disease. There is a small vertiform fibril vegetation along the line of the closure. How we remember in a rheumatoid heart disease? Just remember R for round ball. So you see small round ball on the line of the closure that are the firm and friable. Is it clear? Now next is the infective endocarditis. Just remember the infection. When infection occurs, if there is so many bacteria clubbed together and making the infective dose, then infection occur. So obviously infection when there is so many bacteria, so large bulky fiable, and obviously bacteria causes destruction, so destructive, and it is infective, so obviously not sterile, and infection and embolism can be rhyme. So infection this clot can be embolized. So embolization is very common. So now this picture you can see for infective endocarditis. As we say infective, so there are so many bacteria clubbed together causes infection, and these are the large, bulky, and friable. Now next thing is the is the Vegetation. If vegetation larger than 15 mm, then the higher risk of the embolism, because in embolism you can write one embolism LIS to like 15. Is that clear? Now next thing is a non-bacterial thrombotic endocarditis. As the name suggests, non-bacterial thrombotic or murantric endocarditis. Murantric M for malignancy. It is associated with malignancy, and if you invert the M, you can find 3, so it is associated for MLM3. Is that clear? So it is associated with MLM3 and pancreatic carcinoma. Now, non-bacterial thrombotic endocarditis, T4 you can remember like the Trauzu syndrome and the thrombosis. Trauzu syndrome and thrombosis, how we remember this T, and you can match this T and this T. So it is associated with the deep vein thrombosis and Trauzu syndrome. Now, Murantric, other name is Murantric, so just match in Murantric with the malignancy and MLM3. Is it clear? And this is very much similar with the rheumatic heart disease vegetation, but there is a difference is there is also bole, but bole is slightly bigger in the diagram. So you can also see this bole along the line of the closure, but slightly in the bigger size, slightly bigger size. So had the vegetation slightly bigger side than the rheumatoid heart disease. Now next thing is the Libman-Sek endocarditis. Just read Libman-Sek has L and S. So just invert SL, so SLE. So there are so many S in the Libman-Sek endocarditis, like is associated with SLE and is a small to medium flat and verrucous, and it is on both sides as the Libman contain the B. What is the meaning of B? B means both. So both side you can see Libman sec, and it is obviously sterile. So all are the started from the S, SLE, small, side both, sterile, and embolization obviously uncommon. In this diagram you can see like both side. Only this diagram show both side. So Libman sec. B means both, S means side, both side Libman sec and SLE and small. Is that clear? And sterile. Now, next thing is the lesion with the highest risk of infective endocarditis. The very significant risk in VSD, very least risk in SD. SD has very least risk. An IV drug abuser associated with tricuspid wall involvement in the endocarditis. How we remember tri-IV drug? Tri means tricuspid, IV drugs. Now, type 1 MPGN is the most common glomerulonephritis in the infective endocarditis. How we remember? Just write infective endocarditis. I look like 1 and E look like M. So type 1 MPGN is the most common infection. Now the question for her you. So tell us in comment section what is the Dukes disease, Dukes criteria and Dukes staging, and what is the four other name for the fourth disease. Now we are seeing the treatment of infective endocarditis as per organism. As streptococci, penicillin and gentamicin are given, just see GPS. We are using GPS for street location. Street location. So GPS means gentamicin, penicillin and streptomycin for street location. We are using GPS for street location. Now Staphylococcus aureus infecting native wall, so wall for vancomycin. Now, prosthetic wall just read as prestigious vein. Prestigious P means prosthetic, R means rifampicin, and prosthetic vein means vancomycin, prestige means gentamicin. Now, enterococci, just remember you are entering in the new age. Age means ampicillin, gentamicin, and enterococcus. Now, Hackett group, hack the case, you hack the case. So, what is the meaning of case? Ceftriaxone, ampicillin, and sulbactam. Now, Coxiella burnetii, just say hi dear Burnetii. Hi dear means hydroxychloroquine, doxycycline in the Coxiella burnetii. Now, Bartonella is the barking dog. Barking dog means doxycycline and gentamicin. Tell us in comment section barking dog cough where is seen. So, in this way, we are summarizes the infective endocarditis. Please make one flashcard which contain total eight slide. Take a page like this and divide in the this part and write main point in the like most common organism, vegetation, immunological phenomena and the treatment in the one page and submit in the our telegram group. Thanks.